Good afternoon, Excellencies, honorable speakers, distinguished guests, ladies and gentlemen. First and foremost, we would like to extend a very warm welcome to all of you for joining us today at the G20 site event, Redesigning Pandemic Prevention, Preparedness and Response, Lessons Learned and New Approaches. This event is brought to you by Center for Indonesia Strategic Development Initiatives in collaboration with Yop Lang Institute, Pandemic Action Network, Equal International, and G20 Indonesia, the Prakarsa. My name is Sadika Hamid, and I will be the MC for today's event. It is our honor to welcome Dr. Maksi Reinrondonu, Director General of Disease Prevention and Control, Ministry of Health of the Republic of Indonesia. I would like to also welcome all distinguished speakers and guests, Ms. Priya Basu, Executive Head of the Pandemic Fund Secretariat, Dr. Christoph Ben, Director for Global Health Diplomacy, Yop Lang Institute, Ms. Eloise Todd, Executive Director and Co-Founder of Pandemic Action Network, Ibu Dia Saminarsi, Founder and CEO of CISD, Mr. Khalil Elwardigi, GPI Program Director of Equal International, Mr. Ahmad Tuhan, C20 Sherpa Indonesia and Executive Director of the Prakarsa, Dr. Pongsak Niti Karun, Director of Health Administrative Division Ministry of Public Health Thailand, Dr. Krishna Reddy Nalamala, Regional Director of Access Health International, Ms. Nenet L. Ortega, Country Manager of AIDS Healthcare Foundation, the Philippines, and Dr. Simon Reed Henry, Co-Chair of Global Public Investment Network. Thank you for receiving our invitation, and we are very honored with your presence. The experience of the past 2 years has highlighted the absence of preparedness-oriented global health architecture. Indonesia, as the holder of the G20 presidency, prioritized the agenda of strengthening global health architecture as both long-term exit plan from the pandemic, as well as preparing global preparedness capacity. Before we proceed to the panel discussion, let us first listen to the keynote speech from Dr. Maksi Reinrondonu. Dr. Maksi, the floor is yours.
Excellencies, distinguished guests, ladies and gentlemen. First of all, apologies on behalf of the Minister of Health, Bapak Budi Sadikin, since the Minister cannot attend this G20 site event in person due to an urgent schedule. Allow me to thank the organizing committee of this G20 site event, Center for Indonesian Strategic Development Initiative, CISD, and partner for inviting Ministry of Health to deliver this keynote speech. It is a great honor for me to be part of this very important site event and to share with you my perspective on the role of G20 Health Working Group in advancing the global effort to strengthen global health architecture, in particular how the G20 Health Minister action to strengthen global health architecture related to low middle income countries in terms of advocating its interest in the pandemic preparedness and response. Distinguished guests, ladies and gentlemen, Tom Burnett, an American author, voice actor, and radio host, used to write this: in school, you are taught a lesson and then given a test. In life, you're given a test, then teach you a lesson. This aphorism illustrate our battle against COVID-19, our global response, and the lesson that we learn the hard way from our own experience in this battlefield. Of course, there are numerous lessons learned from our global response to the pandemic. However, if I had to single out one for our context of discussion today, it will be this: the world had underinvested in the pandemic preparedness and response, and therefore become ill-prepared for the pandemic. As we have experienced firsthand, such underpreparedness has imminent implications. It began with the health crisis and then spilled over into the crisis in our economic and social life and well-being. In order to respond to this unfortunate global situation, our G20 presidency underscores the importance of strengthening our global health architecture. In fact, this has become the counterpiece of our presidency, particularly the G20 Health Working Group. Distinguished guests, ladies and gentlemen, from our experience in dealing with the impact of the pandemic, we have also learned that we are in the dire need of predictable and sustainable financing for pandemic prevention, preparedness, and response, we call PPR. This has been a critical gap in the global health architecture that we need to address. The G20 high-level independent panel, the WHO and World Bank have estimated there is an annual pandemic PPR financing gap of approximately $10 billion. We understand that this is not easy task, but we think that the best way to go is to put in place a predictable and sustainable financing mechanism for pandemic PPR. And I am pleased to share with you that we have been able to develop a new financial intermediately fund for pandemic PPR, or better known as the Pandemic Fund, hosted by the World Bank and under the central coordination role of the WHO. This pandemic fund aims to address critical pandemic PPR gaps and build capacity at nation, regional, and global levels, bring additionally in financial resources for pandemic PPR, catalyze complementary investment, and facilitate a coordinated and coherent approach to pandemic PPR strengthening. We welcome the Pandemic Fund's inclusive membership and representative from low and middle-income countries, a civil society organization, and donor, and acknowledge the WHO technical expertise and central coordination role in this and effort, which reflect its leadership role in the global health architecture. Up to the present, we have been able to secure a financial commitment from both G20 members, non-G20 countries, and philanthropies for over $1.4 billion for the fund. And we hope that more and more countries, both G20 and non-G20 countries, as well as philanthropies, will join us in this noble undertaking. Distinguished guests, ladies and gentlemen, looking at the global response to the pandemic, we understanding that inequitable and ultimately access to medical continuous, particularly vaccine and diagnostic, in some part of the world has become a critical issue. No doubt, this situation has compounded the effort to bring the impact of the pandemic under control. The Global South represented an important part of the world whose capacities in health security need to be strengthened further. We do hope that the pandemic fund will be able to bridge the critical gaps of the Global South in pandemic prevention, preparedness, and response. In addition, as the G20 presidency, we are strongly committed to advancing the research and manufacturing hubs in Brazil, India, Argentina, and South Africa. We have made some progress in this area by engaging these countries in exploring and working together to identify our common needs and to expand manufacturing hubs and research centers that will be beneficial in strengthening our global health architecture. Distinguished guests, ladies and gentlemen, our G20 presidency has played an instrumental role putting in place the pandemic fund that we all have hope for in addressing the critical gaps in PPR. It is clear that this pandemic transcended its presidency G20. It has been initiated by the Italian presidency and brought into its full realization during our presidency through its officially establishment and launch. I do hope that during the India presidency next year, even after the Indian presidency, this pandemic fund will continue to grow and grow, and will be able to serve its purpose as it has been expected by all of us. Thank you.
Thank you, Dr. Maksi, for your speech. We are now entering the panel discussion segment. There will be 2 sessions, Pandemic PPR Time for New Approaches, and Pandemic PPR Towards Resilient National Health System, which all will be led by our distinguished moderator, Alois Toth. Alois Toth, you may come to the stage. Thank you. Alois Toth is the Executive Director and a co-founder of Pandemic Action Network. She is an advocacy, policy, campaigns, and strategy specialist with more than 20 years experience working to improve life. Okay, Alois, the stage is yours.
Hello. Thank you so much. There we go. Good afternoon, Your Excellency, ladies and gentlemen. I'll be moderating today's 2 panels. As we know, the world needs new ways of approaching pandemic prevention, preparedness, and response. From the experiences we learned, what we have did not protect us from the tidal wave that was COVID-19. The day after today, the day after the official launch of the Pandemic Fund, we'll be hearing about how this and other initiatives can help to raise new resources for pandemic prevention, preparedness, and response, but be built differently so that the decisions over those resources are more equitable than ever. Through this discussion, we'll invite all our speakers to highlight the key steps and policies needed to help get that new approach. And I'd now like to invite our distinguished panelists for our first session on stage. Please give a very warm welcome to Ms. Priya Basu, Executive Head of the Pandemic Fund Secretariat, Dr. Christoph Ben, Director for the Global Health Diplomacy at Joop Lang Institute, Ms. Dia Saminasi, Founder and CEO of CHISDI, and Mr. R. Muftuhan, C20 Sherpa for Indonesia and Executive Director of The Precursor. A very warm welcome to the stage to our speakers. And as a friendly reminder, you've got about 5 minutes, and we have started a little bit late, so if we can try and respect that, I'd be grateful. And that will give us time for questions and answers afterwards from our audience here. So to our first speaker, Priya Basu, we're keen to hear on this day after the launch your thinking on how the Pandemic Fund will be different compared to previous approaches, and also a little bit about how it will actually fill the financing gaps for pandemic preparedness and prevention and response that we have. Particularly, we're keen to hear about the uniqueness of the governing structure. So thanks for being here, Priya. The floor is yours.
Well, thank you very much, Eloise, and greetings to everyone, my fellow co-panelists and the distinguished audience. It's a pleasure to be here today to speak about the Pandemic Fund, which was just launched yesterday. At a very successful high-level event organized by the G20 Indonesia presidency on the margins of the Finance and Health Ministers meeting. As was highlighted at yesterday's event, this is really the first time that the international community has come together with a funding mechanism focused on investing in pandemic prevention, preparedness, and response for developing countries. And the fund really is a testament to multilateralism. We're pleased that 24 donors have already pledged seed funding of $1.4 billion for this fund, and this really would not have been possible without the leadership of Indonesia and Italy during their respective G20 presidencies. The World Bank, together with the WHO and partners, worked really hard to develop and establish the Pandemic Fund in record time. And we thank our civil society partners for valuable inputs that they provided along the way into the Pandemic Fund's design, and they're continuing to now provide input through strong engagement on the fund's governing board. CHISD and the Pandemic Action Network and others were very active and have provided really great inputs that have enriched the structure of the fund. This fund, Eloise, you asked what's different, what's unique. Well, I've already mentioned it's the first time the international community has come together around a fund that's dedicated to PPR. This dedicated fund provides an additional stream of long-term funding for critical PPR functions, PPR as in pandemic prevention, preparedness, and response functions in low and middle income countries. And the aspiration is that it will provide investments and technical support at the national level, at the regional level, as well as at the global level. It's expected to support and reinforce capacity building and implementation of PPR under the International Health Regulations 2005 and other internationally endorsed legal frameworks that are consistent with the One Health approach. And so in this way, the Pandemic Fund really has a unique role to play in making the world safer. Investing in pandemic prevention, preparedness, and response is a global public good. It benefits everyone across borders. And every dollar that we mobilize now and invest now in PPR for low and middle income countries will save lives and financial costs for the years to come. In the face of multiple crises, there are many different priorities, and both international financiers as well as governments themselves, get stretched, and there are so many competing priorities. So this fund will hopefully help the international community maintain a strong eye on pandemic prevention, preparedness, and response. But also at the same time, we hope that it will encourage countries themselves to prioritize this agenda and increase their own efforts, their own financial efforts and domestic investments in PPR, as well as the efforts, in terms of coordination and ensuring leadership on this agenda. You talked about you asked about the governance and sort of operating arrangements. We have a very robust governance structure. Again, that has benefited from extensive consultations over the past 11 months. And just to highlight sort of a few key features of the governance structure. One, it's a very inclusive governance structure. It really, this fund does stand out in terms of balanced representation on its board from contributors as well as co-investors. We have 9 seats for contributors, 9 seats for sovereign co-investors. We have 1 seat for our foundations and philanthropies, and we have 2 voting seats for civil society organizations. So in that sense, it is quite unique in its structure. We have two board chairs, co-chairs, both of whom are from the Global South, Dr. Khatib Basri from Indonesia and Dr. Daniel Angamije from Rwanda. Another key principle that's guided this fund is its flexibility to operate through multiple international financial institutions that are engaged in pandemic prevention, preparedness, and response. So it's not kind of recreating a new institution. It's really a funding mechanism that will channel money to countries and regions through existing international players, drawing on their comparative strengths and advantages. And these are the 7 multilateral development banks, including regional development banks, the Global Fund, Gavi, and CEPI, and 3 UN organizations, WHO, UNICEF, and FAO. And then lastly, it really does build in high standards of transparency and accountability, and you will see that. Please do hold us accountable. We've committed to that, and you will see that we will publish everything, as we begin to start implementing the fund, projects and programs. We have committed to putting everything out in the public domain, and we already have much of our sort of governing material and so on that's available on our website. Dr. Basri, I think, was going to be updating you on where we are now and what we've achieved over the past couple of months. So let me just do that on his behalf because he's on his way to COP27. I just want to quickly sort of let you know that much progress has been achieved in a short period of time. So, the fund had its first governing board meeting on September 8th and 9th, and then a second meeting on October 7th. The governing documents of the fund have been approved. And sort of key progress areas that I want to highlight for you are one, the Secretariat, which I'm heading up, has been established at the World Bank with the WHO staff support, and Bruce Aylward, who's here today, who's been a very strong partner in the development of the fund, will be providing, making sure that there's, real WHO support in operationalizing this fund. Yesterday, in fact, at the launch, we made it, very clear that, this fund is hosted at the bank, but it will be operated jointly with the WHO, with a central role for the WHO. Right now, as we speak, we have 3 technical working groups from the board that are working on various areas, developing the results framework, defining what the funding allocation principles and the first call for proposals should look like, defining how to look at co-financing so that every dollar of grant funding that this fund provides is able to catalyze investments around projects. Then we have formed the selection process for the technical advisory panel. This fund will be supported by a technical advisory panel that will be chaired by the WHO, and this panel will provide important guidance and inputs on what the funding priorities should be, and also in evaluating the funding proposals that come in. And we're very pleased that the WHO Director General has nominated Dr. Mike Ryan, Executive Director of the WHO Health Emergencies Program, as the chair of this technical advisory panel. We had an open call for applications to serve on the panel, and we received over 300 applications for the 20 experts that we need to select. So the board is now doing the selection process for these, and also in the process of appointing a vice chair. Many other areas of work are ongoing. There are contribution agreements being signed. There's an accreditation framework for accrediting additional implementing entities that's under development. A framework to manage conflicts of interest is being developed. And of course, resource mobilization efforts continue. I'm very pleased to share that just in the past few days, we have 2 new contributors that have come in, which make our total number of contributors to 24, and then we're expecting a couple more at the Leaders Summit tomorrow and day after to announce their pledges. So, lots of work and lots of next steps, but this pandemic fund really is an opportunity to do things differently, to help countries, regions, and the world become much better prepared and deal with the risk of future disease outbreaks, building on what we've learned from COVID, from our successes as well as our failures. And I think we all agree that there's no one magic bullet that helps address the challenges of public health. But what COVID has shown us is that there is an urgent need to step up investments in health systems and PPR capacities at all levels. So at the country level, critical needs such as disease surveillance capacity, laboratories, health workforce strengthening, emergency communication, coordination and management, and very importantly, community engagement. And that's where our civil society partners on our board have been providing, very helpful input. How can we sort of, invest in communities so that they can also play a critical role in surveillance and kind of, outbreak detection as well as response. And then we're also focused on building regional and global capacity. It's sort of a bottom-up approach. So all of that will happen through the implementation next year. This year was the phase of developing. This was the, kind of the year of developing the fund. Now it's launched. Next year it's going to be implementing the fund. But we're confident that with all the support that we have and the additional support that's rolling in, the pandemic fund will play a key role in helping to reduce the risks from epidemics and pandemics in the most vulnerable parts of the world, contributing to a healthier and safer world. So we look forward to the continued support and engagement of everyone that's in this room here as we translate this vision into action. Thank you so much.
Thank you so much, Priya. Thank you. You talked about doing things differently, and we're moving to our next speaker now, Dr. Christophe Ben, who may elaborate on that a little. Christophe is Director of Global Health Diplomacy at the Joop Lang Institute. And we're going to hear from you, Dr. Ben, on global health inequities and how the global public investment model might serve as a new paradigm for the fund. The floor is yours.
Thanks a lot, Eloise, for the kind introduction. And first of all, huge congratulations to you, Priya, and your team. As you said, it's really absolutely impressive what you've been able to do over the last few months in a very short period of time to set up this fund. So absolutely, congratulations. Fantastic achievement to have the fund launched here at the G20. And also, what you also mentioned, the inclusive governance structure. There are many innovations already in the new fund, and I think there were many references yesterday at the launch. Many panelists mentioned the inclusive nature of the governance, so that was very much recognized. So absolutely, you're off to a very good start. And we want to see this pandemic fund, of course, to succeed and be as successful and effective and efficient as possible. Now, I will talk a little bit more about what I see as a big challenge for basically all funds, that is to attract enough funding so that you can indeed support all the countries with all the kind of plans that they will submit to you and, meeting their expectations in being better prepared for, future pandemics. And this is no doubt a very difficult environment for that. I've been directly and indirectly involved in a number of replenishments this year, including CEPI and the Global Fund and the polio eradication campaign and so on. All very, very important causes and very important organizations in the global health architecture, but they've all struggled to meet their funding needs. And that's not because they didn't make a good case. It is because the environment is so difficult and so many claims on donors' generosity and so on. That is a challenge. The other challenge is that we've seen more and more a very strong concentration of donors. Basically, it's 6 to 12 donors that pay for most of the international health and other organizations. Now we are looking at climate and other important causes. And when you have that choice, you can try to get more money out of your existing traditional donors, or you can try to kind of bring in more donors. And what we and many of us here on the panel and the co-organizers of this event have been arguing for are these principles of global public investment. That basically mean, in short, we always say it means all countries should take their responsibility and contribute, all countries benefit, and all countries are part of the decision making. I think this can be very critical, and the pandemic fund might be in a particularly good position to implement some of that, because pandemic preparedness and response is clearly something that is relevant for all countries, of all income levels, of all geographies, more than some of the other funds that I mentioned. And you have already made very important steps. Congratulations to the Indonesian government, our host, and making this kind of pledge and co-chairing the board. This is absolutely innovative as well, to have Indonesia and Rwanda co-chair the board. So there are many elements that you already have, but we believe you can build on to attract as many countries as possible to contribute to this pandemic fund. But it requires then also, to have the right incentive structure so that all countries feel, they want to contribute because they see the benefits for their countries, for the global community, for making the world a safer and more secure place, but also then having their kind of voice in the governance structure. We heard that also in an earlier, session today, the question, how do people decide? How are communities represented? And again, you already have 2 civil society constituencies on the board. So we have to build on these elements, but we really believe that this might be a contribution to the pandemic fund, how to kind of broaden the base to the support for this emerging fund, attract more resources from all countries around the world, and we would be more than happy to work with you and your team on that to make that happen. Thank you.
Thank you so much, Christoph. Moving on now, we're going to hear more about communities and civil society from Ibu Dia Saminasi, founder and CEO of CHISDI, our partners here in Indonesia. We'd love to hear from you, Ibu Dia, on decolonizing global health, what it means, what that means to communities and civil society, and about what does it take to get meaningful CSO inclusion in global health. The floor is yours.
Now it's working. Thank you, Eloise, for the question. Unpacking decolonizing global health in 5 minutes, I think that is sort of a tall order, but I will give it a try and we'll put the case on point to our convening today. But first, I would like to echo Christoph on congratulating Priya, the World Bank, Bruce, the WHO, and others, other countries that have been championing the pandemic fund. And of course, I would like to applaud the government of Indonesia for making such a huge strategic and very important step in showing commitment, true commitment to multilateralism. I think, Pak Maksi, please convey our regards to the minister himself. So on the topic of decolonizing global health and how civil society and the general public really involvement in this, we have been living through a very life-changing experience with the pandemic. And I think life-changing mechanism or life-changing governance is what we are called to do right now and onwards. One of the key examples have been shown by the government of Indonesia to make a huge step in making the pledge to the pandemic fund, not only to the pandemic fund, but also to CHEPI and also to the global fund. That type of step is the first that has been taken by the government towards multilateralism and global health. I think that is one of the key examples of decolonizing global health, and that is showing ownership, that any country can have ownership to global health. And we are by no means bound by the usual steps that have been taken prior to the pandemic. If we want to stay away from the pandemic, if we want to extend the next pandemic to be as long as possible from now, then that type of step needs to be taken. Another step that needs to be taken, and this is with the objective to explain or give context to decolonizing global health. I'm sure I'm doing no justice to the in-depth topic, but it's also to ensure inclusion, meaningful engagement of the not so usual suspects. There are many actors of development at national level, but also in the global level, that have been previously been, albeit inadvertently, left out from making decisions, making important and strategic decisions in global health policy. And I think our gathering today shows that civil society is a force to reckon with, that we can generate the demand for ownership that is needed, that global health is not only global facing or outward facing, it's also inward facing, and it also calls for deconstruction of the way we think about global health. And civil society inclusion and meaningful engagement must be made as the norm. We must not keep knocking on doors. Every time there is a global initiative, we have to make sure that the pandemic fund is a good step, is the foundation that civil society needs. And now, as Priya has mentioned, 2 voting members are in the governance of the pandemic fund. And we must ensure that such step is being taken in other global health platforms. I end there. Thank you.
Thank you so much, Ibu Diah. Very wise words. I'm delighted to introduce our next speaker, Mr. Maftuh C20 Sherpa for Indonesia and head of the Prakarsa. And we're going to listen to you talk about the role of CSOs in the pandemic fund governing body to tackle inequity in accessing vaccines and healthcare in particular. The floor is yours.
Thank you, Alois. Thank you, Excellencies, colleagues, and all participants here. Thank you to all speakers that bring a lot of information and ideas that provoking us how to following the pandemic funds initiative during Indonesia presidency of G20. First of all, allow me as a C20 Sherpa Indonesia 2022 and Executive Director of the Prakarsa to welcome the G20's initiative to establish financial intermediary fund, pandemic fund that had been launched yesterday here in Bali. We expect that it will contribute to alleviate unequal gap for access for healthcare, not only on prevention, preparedness, and response pandemic today and in the next future, but broad on healthcare access. So give this expectation, it stands to reason civil society organization to support and take a part to this initiative. So in our C20 presidency, we have access vaccine and global health working group. The coordinator of working group attend here with me, and we have a proposal, so-called our role that must consider not only through World Bank and WHO, but with the G20 member countries. First is about how the pandemic fund and recognize number of CSOs to help the government to prioritize the policy and program. Why we are keen to propose that we can help to make a program prioritizing, because we have a good connection with communities at the ground level. And we, as a C20, not only from G20 member countries, but also from non-G20 member countries all over the world. So we have a strong engagement among us. We have a social capital. We have a strong commitment, and indeed we have also contribution during a pandemic response on COVID-19 pandemic. The second is on develop principles and norm standard. Why we are keen to propose the principles and norm standard? Because without a principle and norm standard, we will have going nowhere potentially in the next future. Because we have some experiences in the previous, the big contributor usually direct the governance of the funding mechanism or the institution. The third is providing evidence from the fields. It is also very important because a lot of communities lag behind, a lot of voice from the voiceless not bring at our conversation. So we keen to provide evidence from the field. And the next is generating best practices from the communities level. We have an innovative way, but we don't have how to scale up the innovative ways on prevention, preparedness, and response pandemic at the community levels. For example, when some communities practicing micro lockdown in the some area in the Indonesian context, it is a very good example that communities level have innovative ways, but they don't have a resource to scale up broader communities. The last is about monitoring and providing a recommendation to policy and program improvement. So that's our proposal, and we must take into account as well from a global initiative previously, such as Global Fund, Gavi, and others global initiative that multi-stakeholder partnership, meaningful collaboration will contribution the delivering a program and will good impact for communities. So in regard to the World Bank mechanism, right now the civil society policy forum in the bank and in the funds on the selection process, the working group of civil society policy forum, mid of November will be announced by the fund and the bank who's elected to sit in the working group of civil society policy forum in World Bank and IMF. My additional proposal is how the bank and the funds use civil society policy forum to strengthen channeling between CSO and the fund and the bank through the pandemic fund. I think it is quite good to make sure that the civil society not working at a silo approach with other stakeholders. The pandemic fund governing body as well not use a silo approach to work with other stakeholders. I think that's all from my side for now. And I'm just echoing Priya mentioned before that a community engagement is important to make sure that the pandemic fund will be more successful in the future compared with previous initiative. Thank you.
Thank you so much. Great way to end. We're now going to transition to our Q&A section. If you would please, I see a very enthusiastic taker. There are 4 microphone stands around the room. Please go and stand beside, and I will alternate. Our friend at the back there, do you want to start and ask your question? Please head to a microphone stand. First question at the back, please.
Yes, let me be enthusiastic, absolutely. Thank you very much, Marvin Meyer with World Vision Germany. I have a question to Christoph Ben. A fund needs money. Now a little less. I remember that the high-level independent panel said that we need something like 80 million. But pandemic prevention got cheaper, apparently. We just need 10 billion now, which should be really a joke. I mean, how much did we in the North spend on our recoveries? It was in the hundreds of billions. It went up to trillions. So actually, that shouldn't be a problem at all. But let's say it can be a problem. Then, Christoph, you have been dealing with the how to fund for many years with the Global Fund with something like replenishments. Now, that's an event where people come together, Bono sings a song, and then magically Bill brings $1 billion, and then everything goes home, and sometimes it's a success, sometimes it doesn't. Your career has made it a great success.
If you could wrap up, please. Thank you.
Yes, the question is coming.
Good.
And it's short. What's your recommendation, Christoph, how to fund the pandemic fund? More Bill Gates, invite Melinda, and then Bono again? Or are there better ways to sustainably fund the pandemic fund? Thank you.
Thank you so much. While Christoph's thinking about his answer, I'm going to invite some of our other hands that went up. Please make your way to a microphone. I'll take a couple more questions. Please say your name and organization and who you'd like to address the question to. Thank you.
Yeah, thank you very much. My name is Agung Prakoso. I'm from Indonesia for Global Justice. We are an NGO or civil society organization that focus on WTO issues and also liberalization and its impact to access to medicine. And we are part of the CIPIL 20 Indonesia. My question is, I learned from the COVID-19 pandemic, there is inequality of access to COVID-19 tools, pandemic tools, for prevention, treatment, and containment. And that is what we say in the TRIPS waiver proposal that we support also. And commonly we know that as the vaccine diagnostic and therapeutics. And we in strong position as the inequality or the intellectual property issues is the main barrier of the COVID-19 tools access. And also it's happened for HRV, ARV, TB drugs, cancer, etc. So my question is, how this pandemic fund addressing the inequality issues? Is that only give the money to the countries to buy any pandemic tools, or I don't know, maybe you have an illustration on that side. I think that's all. Thank you.
Thank you so much. And I'll take one more question before coming back to the panel. I think that one was for Priya. Please.
My name is Peter. Sorry, another German here. But I have a question to Priya. You used a word and it triggered something to me that said the fund should be a global public good. And the word global public good, we heard it many times in Germany in terms of access to vaccination. So our previous chancellor used that word. So how do we make sure that this new fund really secures it as a global public good? How do we secure that these are not only empty words as we have seen it, because we all know that there's a vaccine equity nowadays, there's no global public good. So what are the mechanisms to secure honesty and, honesty?
Priya, may I come to you first, since those last two questions were more addressed to you? Is that okay?
Sure. No, thank you for those great questions. So why do we say that pandemic prevention, preparedness, and response is a global public good? We say it's a global public good because investing in this and making the world sort of safer from the risks of the next pandemic benefits everyone. So no matter where you're investing this money, even if the investment is being made in a certain group of countries that are the most high risk or the most vulnerable, the benefits of these investments are reaped by everyone. And just to kind of, this phrase has been used a lot during COVID-19, but no one is safe until everyone is safe. So the aspiration here is to invest in strengthening PPR in low and middle income countries, which really helps make the entire world safe from the next pandemic and, secures a safer, healthier world. And, even though much of the contribution so far is coming, in terms of the financial contribution to the fund, is coming from the global north, I do want to underscore that there are also countries from the developing world that have contributed to this fund. There's Indonesia, of course, with a 50 million contribution. There's China with a 50 million contribution. There's South Africa with a 5 million contribution. There's India with a contribution. So in this fund, there are the advanced economies that have contributed. The largest ones are the US and the European Union. But there are also the developing countries that have contributed. And the promise this fund offers is that with these investments that will be made in the global south, the entire world will become safer. Now, there was questions around equity and inequity. And yes, COVID-19 really showed us that there were deep inequities in access to vaccines and other critical countermeasures, and that's kind of a big lesson that we've learned, which we will build into what the fund finances. And what the fund finances will, on top of things like disease surveillance and laboratories and health workforce capacity, the fund will also in the future support investments in medical countermeasures so that there is supply of these sort of equitable, affordable supply of these medical countermeasures in the face of the next pandemic. So that's absolutely one of the areas that the fund is focused on. But it is something that requires very careful thinking in terms of where the investments need to be made. Does every country need this capacity? Probably not. Maybe you need to think of it in a regional way, so that every region of the world has its capacity, which can then sort of be surged up in the face of a crisis. So just to say that it's part of the scope. And you will see it unroll as the fund begins to get implemented.
Thank you so much, Priya. And now to Christoph, a comment on the 80 billion or 10 billion, and where's the money going to come from, Christoph?
Easy question. Thank you, Marvin. You mentioned the G20 high-level, panel that recommended 10.5 billion, and it was meant, if I'm not mistaken, annually and for the next few years and sustainably and so on. And you also suggest that given the huge economic costs of the COVID pandemic, it should be a no-brainer that the countries then come together and provide 10 billion to this new fund because it makes sense to make the world a much safer place, and the new pandemic will come at some point. Unfortunately, it's not that easy, nor is it as easy as inviting Bono to sing a song and the donors will happily pledge their billions. It's much more complicated than that. But I think the message is, the pandemic fund is so important that many countries should come together and make those pledges. And whether this will be done in a replenishment at a certain conference or not, that doesn't matter. The point is, it doesn't come automatically. You know, and after a first round of pledges at launch events and so on, as what you're experiencing now, from then onwards, you will see that you need to go to these donors and persuade them, you know, to influence the budgetary processes and persuade parliaments and so on. It doesn't come automatically. So that's the kind of hard work. The bonus song comes, you know, at the end, hopefully. And that's, I think, what is ahead of the pandemic fund. We all wish it was easier than that, but it does require this country-by-country kind of process of persuasion. But as I said before, you know, I think if any fund is in a good position to do that and to appeal to kind of also the self-interest of countries, it is the pandemic fund, and you have already some examples where this has happened very successfully.
Thank you. If I can just ask the other panelists if you want to add anything.
Perhaps I would like to add to the last question asked, what do we have now to, why should we trust this type of fund? How do we ensure that it doesn't fall empty words like before? I think the answer, well, there are so many things to be proven just yet. The fund has just been launched yesterday. But I think one key important step is going back to how the governance mechanism, how the board of governance is structured as of now, that provides a clear difference than the one before, which is the inclusion of civil society as voting members, I'm sorry. And I think inclusion of civil society at the global level in the governance board must be echoed or mirrored by a similar country mechanism or national secretariat, whatever it may be, that also includes civil society in its consultation process, in its decision-making process. And the civil society part, and of course with other development actors, but civil society in particular will put life into the fund. It will put life into the mechanism that is being disbursed to countries, because the correct inclusion of civil society will then put voice to the voiceless, to the previously voiceless, and will reflect what the countries and the communities needs. We will truthfully reflect that. And I think we look forward to the implementation phase next year, where civil society, both at global, regional, and national level, can really contribute to giving life, to ensure that it's not just empty words. Thank you.
Thank you.
Thank you. The first question on how to making sure the financing the pandemic fund more sustainable. First, we use official overseas development assistance as our call to the developed country, as a commitment to strengthen their contribution to the developing and less developed countries. The second is we must also try to link up with other policies, such as taxation reform policies at the global level, how we bring domestic resource mobilization as our common agenda to use the platform to collect the fund and to make sure that our pledge will be sustained. The second question, how to secure as a public good. I will propose CSO's principle that we are already discussed on how make sure that pandemic fund will still on a public good. First, focus on addressing existing inequalities to prevent future pandemics by prioritizing right-based transformative and people-centered approach, focusing on equity and equitable access, technology co-creation and knowledge transfer, creating larger ecosystem for developing, producing, and delivering suppliers. Thank you.
Thank you so much. Priya, did you have a little supplementary very quickly?
Yeah, just very quickly adding to what Christoph and Dia also said, the question on additional resources over time, I think one point that we're very focused on is that we have to also show success in terms of the results that this fund produces with the investments that it makes. And we do believe that, that's why we're giving so much care to what we fund through our first call for proposals. And we do believe that, if we're able to, show impact and show that through that funding, things are changing and improving, then success will breed success, and we will be able to mobilize more money. So I just wanted to add that point.
Thanks so much. We're going to have a lightning last round. While you're thinking about your questions and making your way to the microphone, I'd like to invite Dr. Bruce Aylward to say a word or two, maybe from the microphone. Oh, you have one. Great. And 2 or 3 others, please make your way to the standing mics for questions. Bruce, over to you.
Thank you very much. Eloise, for those of you who don't know me, my name is Bruce Aylward. I'm an advisor to the Director General. And like many of you, I've worked in many different aspects of the COVID response. I helped set up the ACT Accelerator and COVAX and run those. I worked with Priya on the new pandemic fund, and I'm working with the G20 on the task force that they're running. And I wanted to thank, first of all, very much, Dia reached out to me yesterday to make sure I would come, and I want to appreciate the comments you made, and as well your comments in particular. And I especially want to thank them for not putting me on a panel, because then I can listen and be a little bit more helpful maybe on some responses. But the first comment I want to make is in reaction to a point that Dia made, and she made the point that CSOs should not have to knock on the door. And I think forums like this are so important, because if more people like myself and Priya and Christoph and others and Eloise are hearing and part of your conversations, we can also be making sure that you are not knocking on the door. We have to, as we design these fora, bring civil society in from the beginning. And I thought, oh, you did such a fabulous job in enunciating the so many reasons for that. I want to reflect on a couple of points that we heard. One was about how do we make sure that this is a global public good? We create a global public good, because the pandemic fund is not a global public good. It can create one, but only, like Priya said, if we invest in the right things. And this is where civil society, again, will be so important, because we need to create a safer world, which means investing on the right things. The second point, there was an important question about how we can ensure equity with the fund. It is not just about buying more vaccines. We will not achieve equity if we just get into the procurement competition. We can only create equity when you take an end-to-end approach. We have to look at how do we do our research and development? Are we doing the right R&D for the right countries? How do we scale up manufacturing? How do we do the policy work? You have to look right across this, as well as procurement. And that's why, as we look at the fund, what we're trying to identify is where were the critical gaps that compromised equity. So the big goal is, again, making sure we're investing in the right things. And this is where the CSO voices on the working groups, on the board, like you said, are going to be so important to getting that part of it right. Just a couple of other quick comments. When we talk about the new approaches, and it's a fantastic theme, new approaches can't only be in the area of financing. Financing is helpful, but it won't solve the problems. We need to fix the governance of the global system so that we have a fairer system. We need to fix the systems so that we're harnessing the richness of all the different players, especially CSOs. And we need to fix the financing. So this is one part of that. The second thing we have to do is not just the new approaches, we need new ways of working. And we heard some of those outlined today. We need to move from this is not just a health issue, it's a health, finance societal issue, and it requires all pieces working together. It's not just WHO's business, it's WHO and the banks, and we are working very, very closely. I spend more time, I told somebody, I made a bad joke, I said I spend more time with Priya than my wife, and that wasn't a very good way to say that, but it gives you a sense of how we are working together now. That's a big shift. But the most important one is what I think Dia referred to. You cannot solve this from a global level. These are societal level issues when you're dealing with pandemics and healthcare in general, let's be very frank. And it doesn't work unless you have trust in the systems, trust in the people who are delivering the messages, trust in the people who are delivering the services. We cannot do this without a whole different way. We have to almost start with the CSOs and their relations with communities, as well as so many other levels and community organizations, and build from there. And really, I think we are seeing something different as a result of the pandemic, but it's very fragile. And that's why, to Dia, the point that you made, you have to stop having to knock on the door. And it's fora like this, with more people in them, less talking from people like me and more listening, that I think we can get there. So just to appreciate everything that you've done in the pandemic, to apologize for how difficult some of it has been, and to thank you for the fantastic engagement and help of civil society in making the fund a success. One of the things I really learned, and some credit to Eloise for this, because she spent a lot of time making sure that we helped bring in civil society properly, was how civil society organized itself in coming to us as we were designing the fund. And it was tough, because when we were designing the fund, some people wanted only donors on the board. Some people only wanted donors and then others. And again, finally, you know, and it was a result of the power of CSOs and how you got organized and found common voice that actually secured those seats. And people learned, the board members were convinced that they could not do this without civil society. And so I think we're in a better place, but not where we have to be. And again, thank you for the comments we've heard and we'll continue to hear, because it's crucial to the success of this as we go forward. Again, Dia, terima kasih for the invitation, making sure I was here, and to all of you for the event.
Thank you so much. Thank you. I'm afraid we're going to have to move on, because time is of the essence, but just to give a bit of a conclusion of that session, we've heard about what a great success the fund is for being launched, a first, a testament to multilateralism, Priya said. In order to make that really a success, we need to make sure any country can have ownership, we need more donors co-investing, and we need those, we need to not just almost start from CSOs, but start from CSOs and communities and make sure that we live that reality. And we need to make sure we can do that and scale as well. So thank you. Can you give a big round of applause, please, for our excellent panelists as they take their seats back in the audience. Thank you so much. And while our panelists are going back to their seats, it's now time for our second panel discussion, which is on pandemic prevention, preparedness and response towards resilient national health systems, a really crucial topic. There have been very unfair power balances that exist within global health, and those were blown open by the COVID-19 pandemic. So in terms of making our systems more resilient and making sure the priorities and needs of all countries are met, we want to explore the possibility of how pandemic preparedness, prevention and response can help to strengthen and create more resilient national health systems. So for the second panel session, we've got another 4 brilliant speakers. I'd like to invite them all now to the stage, so please give a very warm hand to Dr. Pongsak Nitikaroon, MD, Deputy Director of the Health Administrative Division, Ministry of Public Health in Thailand, Dr. Krishna Reddy Nalamala, Regional Director, Access Health International in India, and Ms. Nenet L. Ortega, Country Manager of AIDS Healthcare Foundation from the Philippines, and last but not least, Dr. Simon Reed Henry, Co-Chair of the Global Public Investment Network. You're all very welcome. And Our first speaker is Dr. Pongsak Nittikarun, MD, and we're going to hear from you about the role of Thailand's government in strengthening health system there and hearing how you've incorporated community health workers in pandemic preparedness. The floor is yours.
Okay. Thank you, Eloise, and thank you everyone here. It's my pleasure today to speak about the Thai government that we combat the COVID-19. I think that I will conclude it in 5 minutes. It's a lot of issue, but I try to conclude it. First, we have a high level and strong policy commitment in Thai policy and exemplified by our Prime Minister and leading to the process. Number 2, we have the second one is we have the robust health system to develop for a decade. As you know, we have the primary care, secondary care, and tertiary care. We make it for a decade, and I think that this factor that make Thai health system work effectively to combat COVID-19. And the third is the community health network in Thailand. In the presence of more than 1 million health volunteer village in Thailand, they support by the bottom-up support from the health policy in Thailand. You know that we have a lot of health volunteer policy. They work a lot. They work hard in the midst of the COVID-19 pandemic. They survey the patients, they survey the contact case, and they educate the patient a lot. May I show the picture, please? I have the 2 pictures. I think that the picture may tell a lot of story more than I can say. Can you show the picture? The next one, please. The next one. Okay, you see that in Thailand we have the village volunteer. They do everything for Thai health policy. And you see from the picture that they're screening the people who enter the social events in the village. They give the education for Thai people everywhere. They knock all the door all the village door to educate and how to prevent and how to hygiene and how to prevent the COVID-19. Okay. And the next slide, please. The previous slide. Okay. If the Thai people who are infected with COVID-19 and want to home isolation and or quarantine, the Thai health volunteer to bring, they go to their house, their home, and ask about their symptoms. Are you well or not? If they get very sick, the Thai volunteer will bring them go to the hospital. And the Thai government supply the mask, supply the alcohol gel or any protective to the volunteer. Okay. And the fourth, I think that the Thai we have the innovation solution for problem encounter for COVID-19, so develop quickly. You know that in the midst of the Delta wave COVID pandemic in Thailand, we turned a big conference room in Bangkok to 3,000 beds, and the bed made from the cardboard, the box, and go to the bed to take care of the patient. With that time, is very suffer from the effects with COVID, and we have the policy that develop a lot, just like bubble and shield. Bubble and shield mean that if the factory, if the Thai and migrant worker infects with COVID, we close the area of the factory, but still let them work in the factory to they don't stop the business. Okay, I think that it's my conclusion that in Thai government we have the policy that we have policy flexibility, adaptivity, and pragmatic to deal with the COVID, and we have the strong community connection that is a Thai government do with COVID-19. Okay, thank you.
Thank you so much, Dr. Pongsak, and thank you for bringing to life your points with those pictures. Very powerful, and I'm sure we'll all remember them. Our next speaker is Dr. Krishna Reddy Nalamala, Regional Director for Access Health International. And we're going to hear from Dr. Reddy Nallamala about your reflections on the lessons learned from the COVID-19 crisis and how to best strengthen national health systems as a result. The floor is yours.
Thanks. I think we have been learning a lot of lessons. I think all of us have hundreds of lessons from the COVID pandemic. Maybe I will pick up only 5 lessons which may be relevant, irrespective of whether it is a developed world or underdeveloped world. Because when we look at the performance of health systems across the world, the key outcome in terms of excess deaths per 100,000 population, there was no difference between the developed world and underdeveloped world. That means the lessons which mattered most in the outcomes during the COVID. One, the countries which invested in public health, which invested in primary health care, which invested in community engagement, they did well. Even the rich countries which did not invest in these things did not do well. That's one lesson. To both the countries, it's not just to the low-income countries. The second, the countries which invested and have the capacity in health technologies, whether it's research, whether it's manufacturing, whether it's distribution, and proper utilization with no wastage, they did well. And third, the countries where the people trusted their leadership, they did well. And these are, I won't touch more lessons in terms of what has to be done. The second question is then how do we translate these lessons into the policies, strategies, and actions? Fortunately, there are 3 major global policies which have been articulated, formulated, whether it is Global Fund, whether it is international health regulations, and whether it is global public goods alliances. But to translate these global policies to the grassroots level impact to the common man, there is a huge challenge. I think that's what, it is only the beginning of the challenge. It is not the end of the challenge that the Global Fund is created. Do the countries have the capacities to formulate policies as per their requirement, not as per the global policies? That's one. That capacity has to be built, that there is a context-specific policy making, right? Secondly, do the countries have the capacities to govern and manage complex health systems? That's where the inefficiency is coming. And third is there a mechanism, the learning culture mechanism in each country, learning health systems mechanism, wherein there is an institutional mechanism to understand what happened, what went wrong, and what went right, and translate those learnings into actions on a dynamic basis, because the world will not wait for 15 years for policy to come and then translate into. So I think what, at a country level, that needs to be done, maybe I can just mention at the last minute in terms of what India is doing as a case study. It had 2 major policies in terms of strengthening the primary health care, strengthening the public health, strengthening the universal health coverage. But it rapidly announced 2 more major policies as the COVID pandemic evolved in terms of National Digital Mission, which envisages how the countries can leverage their own digital technologies to build a national health information system, which is critical for dynamic surveillance, which is critical for dynamic policies, agile responses. I think that is critical for most of the countries, not only the developed, but underdeveloped countries as well. The second is announcing the fund for strengthening the public health infrastructure, especially how do you strengthen the local governance? We are talking of the global health architecture, but how do you actually start from the local governance and make it as empowered as possible? Because most of the action actually happens there in terms of reporting a new disease, it's much easier for that local government to report and also to respond in an innovative fashion and adaptive fashion, unless they are empowered, unless they are built that capacity. So I think my own take is that it has to be not only top-down, because hitherto it used to be top-down, it has to be both bottom-up as well as the top-down. I think these are, the few approaches based on the lessons that I learned. Thanks.
Thank you so much. An awful lot to think about in that contribution. I'm delighted now to introduce Nanette L. Ortega, Country Manager of AIDS Healthcare Foundation from the Philippines. And we'd love to hear from you about the role of CSOs in engaging vulnerable groups during COVID-19 and also lessons learned from the HIV/AIDS global response. You have the floor. Thank you.
Thank you, Elise. Is it working? Okay. Good afternoon, everyone. I will be speaking the grassroots way, specific and more definite. Okay. We have to recognize that when the pandemic started, the leaders were just talking out there, but we CSO were already out there distributing PPEs, sanitizers, and disinfectants. We were already providing hot meals to the prisons, and then at the same time, we already started the delivery of antiretroviral to the homes of our clients, including access to telemedicine, using Skype or Messenger at the time. And also we were able to develop right at the outset simple materials of how not to get COVID messages distributed to our communities. These are just some of the initiatives that we were able to do at the outset of the pandemic. CSOs did not take it sitting down. We have a stake, we have a great role, enough to respond to the situation. CSO engagement produces positive results when the context is supportive. So when we say supportive context, it matters for success. And it is characterized by access to information, the willingness of the authorities to engage CSOs, and the due recognition of the technical and financial capacity of the CSOs to implement community-based intervention, and the citizens' willingness to participate in the development processes similar to a whole-of-society approach to a pandemic response. And when these supportive contexts are not found, negative outcomes such as token participation, reprisal, and denial of service, or elite capture, including violent state responses, and community disenchantment can occur. So particularly, the role of the CSOs, I just would like to provide you some examples so that it is more specific. CSO-led initiatives are transparent and accountable. And at the same time, they produce positive outcomes. So some of the activities and implementation that were done during the COVID, particularly in the Philippines, was an integrated COVID-HIV health promotion and installation of a more robust community-based infection control guidelines, and setting up of community pantry that includes food, hygiene kit that contains condoms, lubes, sanitary pads for women and girls, and including printed IEC materials that can be accessed by anyone out in the community. Cambodia and the rest of the countries within the Southeast Asia were able to produce localized or translated into their dialect IEC materials that help them understand what COVID is all about. And then at the same time, we initiated the Vaccinate Our World initiative, wherein we called on rich countries to provide vaccines to low-middle-income countries and have those vaccines land the arms of people living in developing countries. So what are our call for the leaders wherein we can have a great role? This is the increased engagement of CSOs as experts in our program, include us in the decision-making, and we can develop designs that would help communities in their intervention. and then at the same time collaborate on efforts that strengthen meaningful engagement in the decision-making, and the need to recognize the importance of an investment for community responses to health and services. So at the same time, we work with the government and we call them to institutionalize CSOs as part of the response at the community level. And the AHF long-running Fund the Fund has been calling on the rich countries of the G20 to support the expansion of the Global Fund's mandate beyond TB, HIV, and malaria. This would be able to provide a more robust and more permanent responses to pandemics like COVID instead of just emergency responses. And lastly, for a more, we had been calling on governments, partner institutions, and bilateral and multilateral organizations to be more transparent and accountable. But we are also calling on our colleague CSOs to increase their accountability and do a similar transparency as well in our dealings and in our implementation at the community level. It is clear also that we need to come up with a global public health convention, a framework that ensures lower income countries can protect themselves during health emergencies by having access to know-how technologies and to make vaccines and other health products available domestically and regionally. Maraming salamat po. Together we can do this.
Thank you so much. Great. And last but not least, I'm going to turn to Dr. Simon Reed-Henry, co-chair of the Global Public Investment Network. And Simon's going to talk to us about the future of innovative financing in strengthening national health systems, challenges and opportunities. The floor is yours.
Thank you, Eloise. And thank you also to our colleagues Chisti for organizing today's event, and to my esteemed co-panelists for contributing to the discussion. You know, if we want healthy people and healthy national societies that are properly protected against future pandemics, we need more money, we need cooperation and coordination, and we need better decision-making over how the money is spent. That's the bottom line. We need to avoid the situation where, as of August this year, just 60% of the population in lower middle-income countries and barely more than 20% of the population in lower income countries had been vaccinated for COVID-19 with at least one dose. Because these are also the same countries that suffer from challenges of testing and other primary healthcare requirements. And they're where squaring that circle of, for example, rolling out more vaccines in more challenging environments requires a broader-based investment in national and regional capacity, be it primary healthcare, regional manufacturing, or what have you. This is where I think, looking to the future, global public investment can be so important. Global public investment is a new financing modality that provides a way to resource the sorts of shared challenges that all countries, as we've been hearing today, confront, be it climate change or pandemic preparedness, and where existing approaches to international public finance, such as traditional ODA or aid, cannot get us to where we need to go. So let me say just a few words then, I think, building on some of the comments of Christophe Ben and others, about how GPI can help us to address the issue of pandemic financing in particular, from the point of view of what are often quite distinct national needs. GPI's principles of all contribute, all benefit, and all get to decide stake out what going forward may be the only viable path to an approach to pandemic prevention, preparedness, and response in which we've learned from the lessons of the past. That means we have to find more money and we have to spend it better. And we do so by bringing more countries together as partners in determining also more equitably how that money is to be spent. Now, in effect, this means two things. First, and on a practical level, GPI requires bringing governments, communities, and civil society together beyond traditional donor countries. It requires monitoring mechanisms to ensure global public investment dollars invested locally can ensure a public return on that investment that is available potentially to all. That's what it means to fund a global public good, and not just to fund global goods with public money. We also need to recognize, I think, that pandemic prevention, preparedness, and response is about more than just filling gaps. It's about doing so in a way that is mindful of and can help to reduce the prior structural inequalities, such as weak primary health care, that create those gaps in the first place, those weak links in the chain of pandemic preparedness globally as well. And secondly, at the more diplomatic level, mobilizing GPI as a public finance instrument for PPR doesn't require that we burn the house down and start again. It does require that we recognize the old ways of financing global problems will not be enough to address the intersecting crises of planetary and human health that all countries, rich or poor, are caught in. So let me just end then with saying that a GPI approach for PPR could help us to achieve at least 3 critical things. Firstly, an even broader and more inclusive set of countries co-contributing to something like the Pandemic Fund in what, over time, needs to become a proportional and sustainable manner rather than through one-off replenishments. 1.4 billion for at least around 80 countries, if we want to do the job properly, is not enough. GPI offers a new approach to raising those additional resources. Secondly, a new standard of governance to oversee the way that PPR needs are identified, prioritized, and invested in. We've made great strides also with the Pandemic Fund, but there are more miles that we have yet to go, and GPI can help us. Here, I think actually the leadership of Indonesia is a great example. Indonesia has contributed to the fund, will receive from the fund, and along with Rwanda is now one of the co-chairs of the governing board of the fund. This is what GPI means in practice. And then thirdly, public interest commitments to the way that the funding is used to ensure that the outcomes of something like the new Pandemic Fund are accessible to all, that they are synergistic with other ongoing healthcare needs, and that they avoid further indebtedness. Funds are not simply silos. They exist in a world with existing inequalities, and that whole picture needs to be taken into account. And I think the transition now from Indonesia's leadership of the G20 through to India's with the commitments to planetary and One Health give us a fantastic framework to begin to take these discussions forward to a further level where truly global cooperation comes together in the form of meeting a truly global public good. Thank you.
Thank you so much. It's now time for the question and answer session. So if you've got a question for the panelists, please make your way to the microphone. Anybody else? If we take a few at once, that would be great. Got 2 at this mic. Please introduce yourselves and your organization and who you'd like to address your question to. Thank you.
Hi, everyone. My name is Stephen Harsano. I'm the head of public health for Asia Pacific at IQVIA. My question's to Dr. Ortega. Thank you to the whole panel for all of your work. And I wanted to pick up a little bit on what you were saying about civil society and the HIV example, and think about how that may apply. If we think about how HIV, the civil society organized well for HIV, particularly around access to health products, what are the ways that that could also apply to products that we need in future pandemics? I mean, vaccines, obviously, we've seen, but what about other things? Do you have any guidance for civil society organizations in terms of how to support and advance those efforts in terms of health equity for health products? I think we have in the shadow of this, what's behind my question, I guess, is in the shadow of this is COVAX and the fact that rich countries bought 70% of the vaccine supply before poor countries had them, right? And so that's not great, right? And what do we do to sort of be able to make sure that civil society can play a role in seeing that something else can happen in the future? Thank you.
Thank you. Can I take another question or 2? Oh, please, at the back.
Okay, let me introduce myself. My name is Fioriana Prabaswara. And now there are many issues related and economic recession around the world, which can treat the entire world economy and have impact on global health. And then I want to ask how to deal with an economic recession in the middle of pandemic in the future. Thank you.
Okay, thank you. And one more.
Okay, thank you for the opportunity that given to me. My name is John, and I'm from Udayana University. I have a questions. The first is, I would ask you all that how to confine the people that the COVID is really exists. Because as we know, at the first time the COVID is spread, lots of people in the world doesn't believe it. Because in their mind, the COVID is just a project of some people that expense the other peoples. Because as we can see right now, so many corporations that take the profitable from this pandemic. So how to convince the people? Maybe in the next time there will be come other pandemics. So how to make the people in the next time to believe that the new pandemic maybe will become. And the second is, I want to ask how to prevent the data leak of the people, because as we know, vaccinate certificate is very free for the access of the other people, and it can be harmful for the people that have certificate, because we know right now there is no data provision for the certificate. Okay, thank you.
Thank you. If I can go to Nenet Ortega for the first question on the CSOs, the example of HIV/AIDS that you were giving and how that can apply for products for future pandemics. The first question we had addressed to you. How do we take from the lessons learned of what you were describing, your experiences are, how can we apply that to future pandemics, if I've understood correctly?
Okay, based on our experience within the CSO community for HIV and AIDS, how did we respond to the pandemic? That is what you were asking for the guidance, am I right? Okay, so access to products, okay. Okay, so access to commodities and supplies for people living with HIV. In the Philippines, our actual experience is that we work closely with the Department of Health, particularly for the Disease Prevention and Control Program. And when we were already provided with initial information that a lockdown might be announced by the government, immediately with the CSOs, together with UNAIDS and the Department of Health, we came together as one. We developed the guidelines on what we can do together when the lockdown is announced. So therefore, immediately after a week when we had the guidelines, the guidelines has already been downloaded to the different regional offices and the different NGOs. So each of one knows already what we can do as CSOs, as government, and as local government units. So part of the initiative was delivery of antiretroviral to make sure that their supplies is more than enough. And it is a multi-month provision of antiretroviral. It's not just a monthly availability of the supplies, but it is considered for 6 months. And then at the same time, we set up the telehealth or the telemedicine. And this is provided by private doctors, NGOs, and the government as well. In fact, it has become a more sustainable approach because together with the DOH, we were able to come up with a so-called Consulta, which is an online platform accessed by people living with HIV and AIDS. And mind you, the information about them is very discreet and it does not leak at all. So that's just for the ARV and the telemedicine. We also went around we were provided with Safe Pass by the task force, and we can go around distributing hygiene kit. We were distributing food for people living with HIV. And in terms of access to vaccination, majority of the CSO's treatment hubs were provided with vaccines. We were trained by the Department of Health how to provide or administer the vaccines to people living with HIV and AIDS and their immediate families. So these are just the small things that we were able to provide to communities of people living with HIV and AIDS in the Philippines. And most of these activities has been sustained, and a policy has already been provided by the DOH. So on a long term, it is sustainable in approach. So those are the things that we have started when the pandemic came into the country.
Thank you.
Thank you.
If I can ask Dr. Pongsak to reply to that and also maybe take into account the economy question as well.
I try to answer in the Thai experience to prepare if we have this pandemic again and what the preparedness for the economics to not corrupt down. As I speak earlier that in Thailand we have bubble and seal just like that. I think that the preparedness is the most important factor. We have the we call National Business Continuing Plan. You must know that what kind of the pandemic that affects your country, what the business that must close according to the pandemic, and you must have the simulation. What if the simulation that if there's something happen, what will happen in your country? What kind of the business will close, and what is the effect of that thing? And I think that the preparedness by the business continuous planning simulation can prepare the economy not to corrupt down completely. And I told you earlier in my section that the flexibility and adaptability by the situation is very important, and innovation for solution is very important for the solve for the economic problem. Okay, I try to answer. Maybe the other answer more than.
Other panelists want to come in, Dr. Krishna, and then.
Yeah, just wanted to comment on the adaptive, innovative responses which various systems have adopted, right? Like what Philippines has adopted or what Thailand has adopted. But how do we institutionalize these responses? I mean, some of these innovative responses worked, some did not work. It should not be that in the next crisis, again, we go back to the same thing, if we haven't learned from what happened. Most of our health systems, if you look at health system strengthening, the benchmarks are designed for normal states. That means today the disease burden is this, so we need this capacity. They're not designed for crisis states where there is an acute surge in demand, 5 times, 10 times surge in demand. That has to be built in. I mean, that is what he mentioned, simulation. That means if tomorrow a particular infection needs this type of responses based on whatever the potential threats, are we planning for that acute surges? Because on one side, we say just in time to be efficient. On the other side, we need reserve capacity to be resilient. So how do you reconcile these two in a resource-constrained settings? I think these are the learnings. There has to be a mechanism for all these countries to have ongoing basis. What they have learned, what can be put as new normal, and what won't work in the, for example, there was a contact tracing surveillance by the mobile systems. That is appropriate during a crisis, but that is not appropriate during normal times because it invades into your privacy. So we need to clearly define what is appropriate during crisis and what is not appropriate during crisis. Yeah, so this is what I think my theme was, how do we translate these learnings as a culture into health systems. Okay.
Thank you. Simon, do you want to come in on that one or the last question?
Yes, on the first, actually, if I might just build on what Krishna and Nenat have been saying and come back to this question about the lessons of the response to HIV. And it's helpful, I think, to put this in a historical perspective. You know, there was 20 years of activism that led up to the founding of the Global Fund. And a lot of that activism was based on the fact that there were communities that were not receiving the care and attention they should, even within countries and across countries of different income. Then you had the funding. The historical opportunity we have now, right off the back of COVID, is to run those two things alongside each other. That we can't have 15 years of activism followed by 15 years of institutional response. We need the two things to go together. That's why it's so important and so great that the new pandemic fund has 2 civil society seats, that the fund has the capacity to continue to iterate as new members come in and can continue to carry the message and indeed to finance the mechanisms that are required to address it. And I think the great legacy, as it were, of those 20 years of struggle is that we might learn that now and apply it in the way that we move forward on this crisis as well. So thank you for that question.
Thank you. And do any of our panelists want to come in on the last question about behavior change and communications, how we prove COVID exists, what to do about that kind of hesitancy? Did you want to come in, Dr. Krishna?
Yeah, I think one of the important issue, I think, which is not addressed is how do you build health literacy in the population? Because that counters most of the misinformation that was coming in. But as a permanent system, like how do you build this literacy in the schools? How do you build the literacy among the social communities in a way that they can understand? Okay. Because suddenly they're bombarded with so much messaging from the governments, non-governments, vaccine no sayers. They're confused. So it is not acutely you cannot change that system. You need to build that health literacy plan right from school age. You train only 2 people, the mother and the teacher. They will train the community. They will train the society. They know whom to trust. They know whom not to trust. I think the solution to this issue of infodemic, the miscommunication, I think there has to be a permanent solution, a culture change. Because we neglected that literacy divide, the information asymmetry between the patients and the providers, that we propagated because the private sector has an interest only to sell the product, not tell the truth. So who has to counter that? Because they have made investments, so they have to get the returns, so they will sell the product. The rest of the organizations, civil society organizations or the government, are not expecting the returns out of that. So who will invest into that selling a message? So I think, yeah, we need to have a rethinking on this communication system.
Yeah, it's about trust in institutions, isn't it? And the trust in who the message carriers are in those cases. Great. I think we've got time for a lightning round of questions. If people would like to make their way to the microphones for a last 1 or 2 questions, don't be shy. Anybody?
Just one question to Priya, actually.
Priya, you're on the panel
Yeah,
again.
Because, I mean, by the time the Global Fund actually translates into action and then impact, what should the countries do? Because they cannot sit quiet. I mean, so with the limited resources they have, what should they prioritize? I mean, I just give an example. 20% of the meager budget which Indian government has is not utilized every year because there is no health finance management. Then 30% is low value care. That means consultations not needed. So why don't we unlock this locked up inefficiency in the systems of each countries? And another 10-20% goes into corruption. That means you can unlock at least 50 to 60% of money with the limited budgets that is available to start strengthening their own systems while the global leaders actually wake up and respond to these requirements. The second is, are we mapping actually countries' needs? Is there a mechanism to map what actually a country wants? Does it want money? Does it want capacity building? Does it want knowledge? I think we need to map those needs. Just like the civil societies are representing the poor and the neglected people's voice, I think people have to clearly articulate what are the needs of each country. The needs may be totally different. Some countries may not want money, actually. They want human resources. You cannot manufacture human resources just in time. It takes 10 years to manufacture human resource. So how do you pool those human resources? How do you create international laws in terms of movement of health professionals across borders during a crisis? Maybe you have a different laws not in crisis. Yeah, these are some of the, for the global leadership, the questions from the countries.
Some easy questions for Priya there.
No, I think those are excellent questions. And, you know, I think one thing I would really want to highlight is that the new pandemic fund, it really is one part of the solution. It recognizes that there are a lot of existing institutions, both at the national level as well as at the regional and global level, that are already engaged in strengthening health systems and strengthening pandemic preparedness. So this fund seeks to give that a push, and it seeks to incentivize more investments where investments are not already being made, but it recognizes that investments are already being made. So, you know, that's kind of one thing I want to make very clear. And so the first part of your question, what do countries do until the fund begins to get up and running? Well, countries already need to be making investments, and they are indeed, right? So this is kind of, you should see it as a catalyst, as a provider of resources to incentivize countries to do things that they're not already doing. But at the same time, there are many mechanisms out there, financing mechanisms that, you know, are providing bits and pieces. So another kind of value addition of this fund would also be to coordinate efforts and to ensure that at the country level, there aren't 5 different agencies knocking at the doors of government, kind of competing with each other, offering to do the same thing. You know, but to sort of try to bring those efforts together. Now, on the question of, you know, country prioritization and planning, and Bruce may want to add on this too, but, you know, there are these national action plans for health security that countries have prepared, and of course, some of them are better than others, but, you know, this is something that countries are doing and that they're, you know, kind of reporting on as well. And so that gives us a basis to sort of have, you know, clarity on what countries' needs and priorities are. And you're absolutely right that, you know, it's not a one-size-all approach, does not, you know, one-size-fits-all approach doesn't work. Different countries have different needs. Some may need money, some may need, you know, legislation, some may need leadership, some may need all of the above, you know. So, so I think, you know, another point that, you know, I do want to emphasize is that the pandemic fund is going to really put countries at the center and say, you know, countries have to own and co-create the projects that the pandemic fund finances. And then those projects, the design of those projects and the priorities, you know, have to be informed by government through this planning process, but also have to be informed by civil society. So, you know, that's the idea. But Bruce, did you want to add something?
I have to be invited by our moderator.
Of course.
Yeah, no, I think Priya hit the nail on the head. The goal of this fund is to be catalytic, and the goal is to coordinate action. I mean, these are 2 big pieces and bringing in complementary funding. So there was a question earlier, actually, from someone about what civil society can be doing now. One of the most important things is helping countries assess their system and develop the National Action Plan for Health Security, as Priya said. If they do not have a National Action Plan for Health Security that does not involve really all of society in the development of that, the project probably will not be eligible for funding. So there's a strong emphasis. And part of the reason we're doing it that way is to make sure that global agencies don't say, here's what you should fund. It has to come up from below. Because when we say surveillance, in one country it might be a lab machine, in another country it might be training, in another country it might be something else. So we want to make sure that that can be reflected. And then to Krishna's really important point, if you catalyze national investment, you are much more likely to be successful. That is as Priya laid out. So I've just repeated exactly what Priya said, because sometimes we have to hear things twice, but absolutely.
Thank you both. Really clear. And I guess one of the challenges is then how to make sure those countries that don't have their action plans get up to speed very quickly so that the fund doesn't leave any countries behind. A really important point. And also just reflecting on what the panelists have said, that we do have some lessons globally about which countries did better during the pandemic, the ones that had invested in primary healthcare, the ones that had health tech research, and the trusted leadership is a little bit harder to organize. But we know some of the ingredients, and so how can the pandemic fund also be used to kind of catalyze those, and the importance of active surveillance at the community level, like we saw from Thailand, and really making that a priority at the heart. Has that little interlude given anybody any inspiration for a question? I think we've probably got time for a last one or two. This is your last chance. If not, I'm going to go to our speakers for a lightning round of last thoughts you'd like to leave our audience with today to help conclude our session. If I can start at the other end of the chairs. Simon.
Thank you. Yes, and thanks for the questions. Lots to think about and lots of work still to do. I think one of the most important things to bear in mind as we undertake that work, and we here is the institutions of global public health, the global public health architecture, but also governments, national governments, regional organizations, civil society, is about ensuring that we address the fact that different countries are differently positioned in terms of a crisis, that different groups are differently positioned within countries in terms of a crisis, and that finding ways to address those inequities in the way we think through the solutions to the common problem of a pandemic is absolutely critical to making sure that the response to the pandemic will indeed be equitable and a global public good in its nature. I think that's absolutely key. There are lots of ways of doing that. As we say, we have an expression in English, there are many ways of skinning a cat, but some of them are better and less painful than others, and we should take those routes.
Thank you. Nanette Ortega, your closing thoughts.
Yeah, what I can say actually is that governments cannot do it alone. They need the civil society to be part of the decision-making and planning. And it is only through open communication, accountability, and transparency that we can work harmoniously as one, responding to whatever pandemic comes in, not only for HIV, not only for COVID, but for future challenges that we will be facing. Hopefully, there will be no more pandemics in the future. So that is just the word that I can give everyone, particularly to my colleagues from the CSO communities. Thank you.
Thank you so much.
Yeah.
Dr. Krishna.
Yeah, I just wanted to echo the next year themes, which are age-old Sanskrit sayings. That is, Vasudhaiva Kutumbikam, that is, the world is one. World is a family. It is not separate. Okay, so that's one. Then second saying is Sarve Jana Sukhino Bhavantu. That is, every being, it is not just human being, every being, be happy and be healthy. So this is the theme, driving theme for the next G20. Thank you.
Fantastic. Dr. Pongsak, your closing remarks for the last minute to leave with the audience.
Closing remarks that let everyone know that how about most, it's very important about the community connection level. Just like the Thai health volunteer, we have more than 1 million. Is the key success in Thai in Thai government for battle with COVID. I think that the health volunteer it can make possible in the other country. I think we have an incentive for them, just like the salary for them, but it's not too much. It's a little for living, and we have the incentive about the education for their family. For their family, just like send her daughter to the nurse school or something like that, make them proud and make them the great, we call the great soldier of the Thai health government. It's a Thai health volunteer. I think everyone can do for just like Thailand. Okay, it's my closing.
Thank you so much. We've heard, thank you. We've heard from our panelists here practical examples from countries, examples of what it's taken to actually provide best case scenarios against COVID, community level work, and how we can maybe invest in a new model like global public investment to bring every country to the table. If we're really to live that maxim that no one is safe until everyone is safe, we need to persuade countries. We need to show them the obvious that no matter how much they invest in pandemic prevention, preparedness, and response at home, they could have the perfect setup. But if a country around the world doesn't have that same perfect setup, then their investments are for naught. It's a basic point. It's one that we keep needing to make because the world is one, as Dr. Krishna said. And so I think we have an opportunity with this pandemic fund to bring more countries than ever to the table, to raise the billions more that we need, that we know we must have. And the case couldn't be more clear. So we have to be absolutely relentless in making it and using this to show that new models can really move us on and take us to that pandemic prevention and preparedness state that we need to be at. So if you join me in thanking our distinguished panelists for their brilliant contributions, and you can kindly make your way back to your seats. Thank you so much. And now I'll pass back to my colleague. Thank you.
Thank you, Eloise, and all the speakers for the great panel session. Let's once again give a warm applause from them. Okay, ladies and gentlemen, we have finally reached the end of today's event. We would like to convey our sincere gratitude to our speakers and all of you who participated in this event. We hope the event today has been meaningful for everyone. Counting down the day to the Leaders Summit, this event is the right momentum to pass the lessons learned and send the right precedents on the importance of the new approaches to the next presidency. Yeah, it has been an honor for us to host this event today. Thank you all for joining, and we hope to see you again in the upcoming agenda. Enjoy your evening. Thank you.